So patient empowerment is closely linked to another trend in healthcare, which is evolving, and that is consumerism. Now, consumerism is not about supporting hospitals or the insurance companies to have a better outreach to their customers, i.e., patients, namely, but it is about patients taking more active part in determining how and where they receive healthcare. And I think with the COVID-19 pandemic, the whole idea of patient empowerment slash healthcare consumerism has gotten a different boost for two reasons. First, the telehealth adoption has gone up. As we know, during lockdowns, there was no other way to receive care but to go through technologies like telehealth, which has forced even most stringent and most conservative healthcare providers to adapt that technology, and so on the patient side. And what it has done is that it has broken that traditional geographical proximity advantage that healthcare providers had when it was about reaching out to the patients. At the same time, patients have realized that if they find better healthcare, not in their geographical proximity, but maybe somewhere, let's say in nearby town, and they can access it with telehealth, then they would rather go there instead of going to a facility nearby, which is suboptimal for them. So patients are actively making that choices now. The other technology which is fueling this patient empowerment is self monitoring. Now, self monitoring in the past was always considered as difficult, not accurate. But with COVID-19 pandemic, just small devices like pulse oximeter, which are so critical for self monitoring of not only COVID-19 symptoms, but many other diseases like diabetes, hypertension, lung diseases, etc., has gone up, and it is somehow more patients are becoming conscious about that they can self-monitor their health, and they are even asking now healthcare providers that they use the self-monitoring technologies and the data coming out of that to do their diagnosis. So I think the whole idea of a bedless or a wallless hospital, combined with the fact that now there is much more acceptance of telehealth and self-monitoring, is fueling much more patient empowerment, and patients are taking active part in deciding where and when they should receive care. And this, when you combine this with the possibility of virtual consultation, will also solve one big issue that patients have today, which is the having quality time with their care provider during consultation. Now, virtual consultations make it much easier both for patients and doctors to carve out that time than when you have to go to a clinic, wait sometimes for hours before you can actually see your provider for 5 minutes, and then go back and drive for another half an hour before you reach home. And that whole experience becomes so demanding, and so less fulfilling for patients that they start to complain about the idea of changing the way healthcare should be provided to them. So I do believe that the moving into more virtual slash bedless or wallless hospitals format would improve and would support this increasing trend of patient empowerment and healthcare consumerism. But what is also very critical in order to make this right is that patients need to be willing to share their data, because at the end, data and ability to access patient data is key for healthcare providers for being able to provide such services in much more seamless and efficient way to the patients. And I think that's up to us and the patient communities to decide how far they want to go down that path.